So I've been afflicted with acne my whole life, and I tried to find a cure and naturally and used all the topical treatments, and they were ineffective, or they only fixed the symptoms marginally. So this was my last recourse, was seeing a specialist after perhaps 2 decades of being afflicted with facial blemishes and facial scarring.
Acne scar treatment is one of my specialties, and I find it highly rewarding as a physician to be able to help patients with their scars. Acne scars can cause significant emotional and psychological impact on many, and even cause problems with interpersonal relationships and professionally even for some. Fortunately, these days, there are a number of treatments available to help significantly improve most scars. To understand scar treatments, it's important to understand the different types of scars that exist in acne, as these, alongside the patient's skin type and downtime, will often dictate the treatments used. Over the last decade, I've been fortunate enough to research and develop combination treatment options for your acne scars. So let's look at some acne scars and their treatment options. First of all, we have ice pick and boxcar scars. Now, these are well demarcated, narrow or box-like scars. They lend themselves to treatments with a technique known as TCA cross, whereby a chemical known as trichloroacetic acid is precisely inserted with a fine needle into these scars. This causes a controlled burn, which remodels the scar. It's a reasonably comfortable procedure, and there tends to be minimal downtime, with most patients heading back to work the next day, and they can wear their makeup as well. Usually a series of 2 to 4 treatments will shallow and narrow these discrete scars. Next, we have rolling scars. Now, these are often some of the most challenging scars to treat, and are a result of the scars tethering skin to the underlying tissue. For most of these scars, a technique known as subcision is utilized, whereby under local anesthetic blocks, these tethers are physically released by a special needle or a cannula. When I do this, I tend to inject back in either saline, platelet-rich plasma, which is harvested from the patients themselves, or filler, which will then fill the void created when the scars are released, and also provide a framework for the formation of collagen and elastin, extracellular matrix, and these all sort of bump the scars up. We tend to follow this up with at the same sitting with my signature CO2 laser, which I consider gold standard for acne scar treatments. I utilize the luminous ultra-pulse CO2 and a fully ablative or fractional mode to treat scars both deeply and superficially, creating maximum impact and blending them optimally with the surrounding skin. The CO2 treatment does have its downtime, usually about a week, but the results are well worth the downtime. For those who don't have the downtime, we utilize the Infini radiofrequency microneedling device. Tiny gold-plated pins penetrate the skin down to 3.5 mils, releasing radiofrequency waves that then break the scar's tissue down. RF needling tends to only require a downtime of 24 to 72 hours, but may require more treatment sessions to reach the ideal outcome. An alternative option is Fraxel laser, which can also provide improvements with low downtime, and it's a procedure run by my nurses and therapists. There are also scars known as hypertrophic scars and keloids, which are thick, stubborn scars, which can be very challenging to treat. And I'll often treat them with a combination of vascular and fractional laser, as well as injections with steroid and scar softening agents. Another scar type are the wider atrophic scars. These are scars that are wide and deep enough that require surgery to revise. I'll therefore often surgically excise these first, making them neater, narrower scars, and then follow them up with laser to blend in. Finally, apart from scars, there's often what's known as post-inflammatory hyperpigmentation, or post-inflammatory erythema, or post-inflammatory redness that can present after. We use combinations of topical medications and pigment and vascular lasers to help with these, and these can often play a big role in improving the overall appearance. So acne scar treatments, as you can see, can be quite challenging. But for me, it's one of the most enjoyable parts of my work, and really a passion. Although it can have serious emotional impacts, please know that for most patients we can provide significant improvements by utilizing cutting-edge combination therapies with medications, surgery, and laser. Take care now.